That's a great segue, Wendell.
Yellow vests for all.
Yeah, I'm curious because we just had State Senator Gustavo Rivera, who wrote the New York Health Act, on our show the other day. I do think that there is a real shot of what's going to ultimately happen. The way we're going to break through is the way we did in Canada, which was this province of Saskatchewan was able to push through universal healthcare first, and then eventually it spread to the whole country. I think something like that is likely to happen here in the United States, and I do think the New York Health Act is the one that's probably the closest right now. Can you talk about some of the things that private insurance is going to employ, especially if momentum really starts to pick up?
I sure will, and I think you're right about the New York Health Act. In fact, I testified at a field hearing, I guess it was year before last, in I think it was Kingston, New York, on behalf of that legislation. The industry will spend whatever it takes to try to kill that bill and others like it. And just to give you an indication of what they do, Colorado lawmakers were trying to pass a bill that would create a state-based public option. The insurance industry and its allies didn't like that. They spent more money lobbying against that bill than any entity had ever spent in the history of Colorado against that very bill. We were asked by advocates to step in and try to expose their dirty tricks, and we did. And the lawmakers did pass something. It wasn't what was originally written, but that's just an example of what they do. During the primaries and the caucuses last year, the industry spent through its front group more money than some of the candidates spent in Iowa, as an example. So that's what they do. And as I said before, it's our money they're spending. They're taking our money to fund these propaganda campaigns. The front group that I referenced is called the Partnership for America's Healthcare Future, and it includes some of the people that the organizations that or parts of the industry that Fidel was mentioning: the American Hospital Association, the Federation of American Health System, which represents for-profit hospitals, pharma, America's health insurance companies. They're all pooling their money to try to keep legislation from happening at the state or federal level.
I've heard this argument that this isn't something that should be done at the state level, that this isn't something that can really work being done at the state level, and that there's almost like a disagreement about that. And I always take the approach that you take your wins where you get them, and you just kind of throw everything against the wall and see what sticks. But I was wondering, do either of you have any opinions on that? Like the idea of this going with this state plan versus doing a national?
I'll start. I think I agree with you. I think it's important to try it on all fronts. And as Peter mentioned, it started in Canada and Saskatchewan and spread across Canada. I mean, it wasn't something that started out of Ottawa. And I think the same thing could happen here. Legislation has passed a couple of times in California, but was vetoed by Arnold Schwarzenegger. Other states have legislation to try to move it forward. Yeah, in California, I think that the Democrats knew that they could support that, and because the insurance
it wouldn't go anywhere.
It wasn't going to go anywhere, exactly.
I love Mick resistance. Don't you like Mick resistance?
Right. But I disagree with those who say we need to dismiss those efforts. There's an organization called One Payer States that I support them and participate in some of their calls and strategy sessions. And I think it's important. I think it's important to keep the pressure on federal lawmakers and to support the legislation that is before Congress as well, too. Who knows what might break first, but I think it's important to try the state approach as well as the federal approach.
Is there a downside? Like, Fidel, do you know? I mean, is there a negative? What are the people that are arguing against that? What's the potential downside of that?
It's really, the devil is in the detail, as we say. So I am in favor of trying at all levels, but we have to have kind of a coherent strategy because we're fighting a massive beast in this effort. So here's where some of the nuances and challenges might be tricky. One is that it's not just about introducing health insurance coverage at the state level and having it be state funded, and then we can talk about how to fund it at the state level. It's about taxing and regulating abusive market power. Mm-hmm. It's about reinforcing existing antitrust laws and implement and actually executing that implementation, which can't be done at the state level. We're talking about multinational corporations that know how to play the system and have armies of lawyers and lobbyists working in this space. So yes, we need to try to push at the local state level, mostly to mobilize these efforts, but the fundamental solution must be at the national level, at the federal level. That's point number one. Point number two, in terms of how do you fund it at the state level, this is where states are different from the federal government, because states are limited by their tax revenues and borrowing capacity, whereas the federal government has the capacity to create money out of thin air, essentially, and have deficit spending at the federal level that states can't afford, which means states will be forced to tax a particular thing to fund these programs. And guess who's ahead of us in this game, especially in Appalachia and the southern states? It's the oil and gas industry. They're saying, if you want to have your state-based system, you need to let us frack, because we're going to create the jobs and create the revenue streams for your states to have your health care. So we're going to pollute the hell out of the state, give you cancer, and out of that, you'll get a little bit of funding for your health insurance system. So we have to be very careful in terms of how do we push for this at the local level, but never lose sight of the bigger prize, of the bigger fight, which must be at the national level for funding purposes, for antitrust and regulation purposes. Those things have to be done at the federal level. But I'm not going to stop people from organizing at the local level. This is extremely important. Right. But at the same time, make sure that we're pushing on all fronts.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.